Okay, I am here in the room with Mr. Boyd Dubois. We had just finished our head-to-toe assessment, and I'm getting ready to call the doctor. So I'm going to call the doctor. Hi, my name is Sarah. I am the registered nurse here taking care of Mr. Boyd Dubois in room 148 at Fortis Hospital. He had come in for he is in here for post-op hip pain from his surgery. He has right hip pain with ambulation. He stated that the treatment had been working and he had been able to maintain adequate range of motion in his right hip, but the treatment is no longer working. So he is here. He denies any injuries or trauma. Some of his previous illnesses, he has had arthritis, hypothyroidism, and GERD. His past surgical history, he states that he has had a vasectomy, but I'm calling about some of my assessment findings. When I was assessing him, I did notice that he did have a little bit of a cough. It was productive. The sputum was white, and it was thin and frothy, and I didn't really notice it. He didn't really have any other abnormal findings about his assessment other than his right hip pain, which we are medicating him with acetaminophen for. However, looking over some of his lab values here, his hemoglobin is 11.8, his hematocrit is at 39%, and his red blood cell count is at 4.5, which is a little low, but those are expected findings from post-op bleeding. So what I recommend is for him maybe drawing up some new labs in the morning to reassess those lab values and just to monitor those if we need to give him more fluids, or we are currently giving him his multivitamin. And maybe I would recommend a chest x-ray too, just to rule out any sort of post-surgical pneumonia that could be developing. His white blood cell count is 9. It's nothing too concerning or leading towards infection, but just to rule out anything from the sputum. So I would repeat that order back to you, and we are going to get a labs drawn in the morning, stat. Okay, and then we are also going to order a chest x-ray. Okay, all right, thank you.